Welcome to another session. I'm Dr. Vasundhara, Senior Consultant Gynecologist, Laparoscopic and Robotic Surgeon, Secunderabad KIMS Hospitals. So today's topic is mostly related to the fertility, and we shall go for the first question. That is, what is the main advantage of in vitro maturation over conventional IVF? See, here 4 options are given. IVM, that is in vitro maturation, is a process where eggs are retrieved without being matured. This process is usually done to prevent ovarian hyperstimulation syndrome. So, wherein OHSS is all because of the hormones which are released at the time of egg release and post which what happens in the phase of luteal period. So, to prevent these hormonal fluctuations, IVM is being practiced recently. So, for which the correspondent answer is reduced ovarian hyperstimulation risk. See, A is wrong. That doesn't allow you increased egg retrieval. That means increased number. And C is wrong, improved egg quality, because there is every chance of getting a low quality embryo is equally there because we are retrieving before they are being matured. High rate of pregnancy rate. As embryo quality may not be as good as that, the high pregnancy rate may not be a question. It may be a question here. So the correct answer here is this is all to prevent ovarian hyperstimulation syndrome. Second question, the couple has been advised to conceive after 1 year. The male partner semen analysis shows normal sperm count but poor motility. What is the most appropriate next step? Answer is repeat semen analysis, start testicular biopsy, intracytoplasmic set. Yes, the answer here is A, that is repeat semen analysis in 3 months. See, azoospermia is a condition where poor sperm motility is seen, in which this is a transient condition wherein we get this kind of picture whenever the sperms are dead or any other local factors which are being seen, for which we have to reconfirm the test with a gap of 3 months. Unless we reconfirm with 2 intervals of semen analysis, we cannot label that as complete azoospermia, wherein the further evaluation has to be done. So, for which all other options are corresponding with the further steps. So, what I recommend is to go for the confirmation of the diagnosis. So, that is corresponding with the repeat semen analysis after 3 months. Question number 3. A couple married for 2 years presented with 1 year of infertility. Physical examination of the male partner reveals left scrotal bag of worm sensation that increases with Valsalva. Semen analysis shows oligospermia with normal pH and volume. What is the most likely cause of his infertility? So the typical word here is bag of worm, represents varicoceles. The correct answer for this question is varicocele. The typical word bag of worms represent proper diagnosis of varicocele. Varicocele is a condition wherein a pampaniform plexus of the testis are enlarged. It leading to the raised local temperature, which affects the sperm quantity and quality. The only condition where condition which can be treated most effectively in women in male factor is varicoceles. The diagnosis is with physical examination and radiological thing, and management is with surgical correction. And other options like testicular failure is wrong because that is a kind of microscopic examination. Obstructive azoospermia is also a microscopic examination. Varicocele represents the correct answer here. Hypogonadotrophism is a kind of hormonal disturbances. Question number 4. 30-year-old woman with PCOS is undergoing IVF. Her estradiol levels are markedly elevated and more than 20 follicles are seen on ultrasound during stimulation, placing her at high risk of OHSS. Which of the following is the most effective strategy to minimize the risk of moderate to severe OHS? So OHSS is a condition where as I said, it happens at the time of triggering. As the number of eggs released, the intensity or risk of the OHS increases. For this, to prevent OHSs, the best strategy is to go for GnRH antagonistic protocol and GnRH agonist receptor. That means here you should always remember antagonistic protocol with agonist trigger. Agonist trigger has been showing a drastic reduction in OHS because it is preventing the HCG surge. So HCG, which is released immediately after ovulation, is the main culprit for OHSS. To prevent this, we have been following GnRH antagonist and GnRH agonist trigger. So all other options are not corresponding. So the correct option here is the A. GnRH agonist protocol and HCG trigger. For option number B, HCG trigger is the main culprit. So we cannot use this. Fresh embryo transfer may not correct the OHSS. And option D, agonist trigger with luteal based HCG support. As I said, HCG should not be given. Question number 5. A 29-year-old man presents with infertility workup. Semen analysis shows azoospermia, FSH elevated, testosterone normal. Testicular biopsy reveals Sertoli only syndrome. What is the next step? See here, FSH is elevated. That means there is something which is there in the testis which is not being taking up the FSH value. So the feedback system, negative feedback system is not working and FSH is being continuously elevated. So the next step is to go for testicular sperm extraction, that is TESE. The clomiphene citrate therapy and IUI are all a condition where egg production is there. The semen production is there. Here it indicates that only cellular cells are there, wherein they need a lot of effort with extraction of the sperms. Question number 6. 34-year-old woman with 3 failed IVF cycles and normal embryos. ERA test shows perceptive endometrium. Best step is to. See, ERA step is endometrial receptor assay test. So this is usually done before the embryo transfer. We have to transfer the embryo when all the factors are favorable. So for this, we have to induce the progesterone 7 days before the transfer. 7 days before to the transfer causes the vascularity along with the thickness of the endometrium, which makes the endometrium receptive for the coming embryo. So all other options are not corresponding to 7 days. So other are wrong. Question number 7. A 22-year-old man presents with infertility with decreased libido. On examination, he has tall stature, gynecomastia, sparse facial hair, and small firm testis. Semen analysis shows azoospermia. Karyotyping reveals 47XXY. Which of the following is the most characteristic hormone profile in this condition? See, all these features typically corresponding to Klinefelter syndrome. The main two important factors are 46XXY with the tall stature and gynecomastia. These definitely guide us to the diagnosis of Klinefelter syndrome, in which there will be high FSH and high LH with low testosterone, because the testis here doesn't function normally. So the negative feedback mechanism in which FSH and LH are very much elevated. So this is a condition which is called primary hypogonadism. Question number 8. A 34-year-old man presents with regular cycles and infertility for 2 years. Ultrasound shows persistent dominant follicle measuring 22 mm with no ruptured despite mid-luteal surge progesterone being elevated. What is the most likely diagnosis? So this typically shows anovulatory cycles. That means ovum has reached to a maturation size, and progesterone surge is also seen, but pregnancy will not happen to this because it will not be released. This is a kind of anovulatory cycles in which luteinized unruptured follicle. That means follicle has formed but doesn't rupture, but luteinization happens, which results in release of the progesterone. So withdrawal of the progesterone causes periods. So this is called anovulatory cycles. So in which they will be having periods regularly. They will think that ovulation happens in a normal way and they won't conceive. So we have to understand this phase, for which we have to evaluate the follicular study along with the progesterone surge, and we have to understand the physiology before treating. Empty follicle syndrome, option A, is a condition we know ovaries are not retrieved. This is a different condition in which follicles are seen empty. Premature ovarian failure is a clinical diagnosis wherein FSS is very high elevated with no periods. Ovarian hypertrichosis is another condition that is called excess hirsutism and metabolic features, not related to the follicular rupture. Question number 9. A couple undergoing fertility evaluation is found to have a male factor infertility. Semen analysis shows 1% normal morphology based on Kruger's strict criteria. What is the best interpretation? Kruger's criteria is a criteria where semen is assessed. It has in which the sperm morphology based on head, midpiece, tail features are used. It is a strict criteria, and in which the correct answer is corresponding to the greater than 4% normal forms is considered as normal by Kruger's criteria. Other options like A, C, D are not corresponding because it considers when coming to option A, morphology is normal as long as motility is preserved. No, morphology is a strict criteria in Kruger's, and option C, it is less than 1%, but it is greater than 4%. Kruger's criteria does not evaluate sperm morphology. No, that evaluates the morphology. Question number 10. According to HRI guidelines, what is the preferred number of blastocysts transferred in a 35-year-old woman with good prognosis? See, to prevent twins and to prevent twin-related complications, to have a high live birth rate, it is always advisable to transfer a woman in a good reproductive age, that is less than 35-year-old with a good receptivity and all. It is always best to transfer a single blastocyst. That is a universal rule that has been practiced everywhere in the recent days. So these are all the criteria which are developed to have a IVF success rate, good success rate, and to prevent twin births and twin related complications. So there the other options like 2 blastocysts is not true. Cleavage stage embryo is not transferred, and the ideal success rate will be more with the blastocyst phase. Morula is also not a kind of HRI guidelines risk. Question number 11. During the process of folliculogenesis, how long does it typically take for a primordial follicle to progress to pre-ovulatory follicle capable of ovulation? What are the main stages of this journey? Say, at birth, all the follicles are stored in the form of primordial follicle. All the primordial follicles develop into secondary follicle, from then to preantral follicle, from preantral follicle to antral follicle, and then to pre-ovulatory follicle. These are the 5 stages in which the primordial follicle develops into a follicle, and then ovum is released, for which this entire process takes 85 days minimum. This 85 days is a standard count, but among these features also certain follicles, like from development to developing from primordial follicle to secondary follicle is non-hormonal dependent condition, but rest are all hormonal dependent condition based on FSH level, based on LH surge and all those. Ovulation number of antral follicles to antral follicle, antral follicle to pre-follicular, and pre-ovulatory follicles are developed. There. So based on this, option 28 days, 40 days and 120 days are wrong. Question number 12. Which of the following statement is true regarding the luteal cells in human corpus luteum? See, as you all know, corpus luteum is formed after the ovulation. This corpus, after ovulation, ovulatory follicle develops into corpus luteum. Among the corpus luteum, there are 2 types of cells are seen: large granule cells and small granule cells. And large luteal cells are derived from granulosa cells, and small luteal cells are derived from the theca cells. These large luteal cells are responsible for production of inhibin, oxytocin, and relaxin and GnRH growth factors. And small cells are very much numerous, but they release mainly HCG and LH hormone. So these are the hormones which are very much needed for the further progression of the pregnancy. Once these large cells are released, which release inhibin, which prevents from polyspermia and which prevents from multiple pregnancies and all those, these small cells which help in supporting the pregnancy. This option is corresponding with the option B, that is large luteal cells derived from granulosa cells. When corresponding to coming to other answer A, both large small luteal cells develop from granulosa. That is wrong, because they're not the sources of estrogen. There may be the source of progesterone. Option C, small luteal cells may produce progesterone and are derived from granulosa cells. No. Small luteal cells are produced from theca cells. Option D, both cells lack receptors. No, this is wrong. Question number 13. During the window of implantation in the human menstrual cycle, that is mid-secretory phase, that is somewhere around 7 days to the ovulation, which of the following combination of endometrial factor is most characteristically elevated to promote blastocyst attachment and implantation? And as we all know, embryo acts as a foreign body to the human uterus, to the endometrium. But there are certain inherent mechanisms developed by nature in which embryo is being recognized as a native structure and acceptance is more. So how this kind of process happens means, because at the time of luteal phase, there are certain hormones are released, so certain factors are released so as to take up the blastocyst as a native structure. So those are all high interleukin factors, integrins and glycodyline. So these factors, like the option is B, that is high leukemia inhibiting factor and integrin AV beta 3 and glycodyline. Option A, that is high IL interleukin and IRF, this is not corresponding to. All these are the factors which are definitely needed for blastocyte implantation. But receptivity, endometrial receptivity is, and implantation is most being affected with high leukocyte inhibiting factor and integrin and glycodyline. Regarding the human Zona pellucida, which of the following statement is correct? Yes, the correct option here is B, option B. That is, Zona pellucida prevents polyspermy mainly through the action of ZP3 and acts as a species-specific ligand for sperm. See, once the fertilization happens, Zona pellucida action starts. Zona pellucida has different type of action. Different types of Zona pellucidas are there. There are ZP1, ZP2 and ZP3. See, for anything to entry, like something, if you are going, if you are entering a door, we just go near the door, open the lock and then enter. The same principle applies here. First, when the sperm comes and attaches to the ovum, so then first adhesion happens, and then attachment happens, and then maturation happens. So for which different types of ZP factors play a role. The ZP1 plays an important role in cross-linking and structural integrity. The ZP2 plays an important role in interaction. ZP3 is an important factor which induces acrosomal reaction. So all these factors which help in binding of the sperm to the ovum. So ZP3 is the primary sperm receptor which triggers acrosomal reaction. ZP2 maintains the sperm binding, and ZP1 helps in structural integrity. Question number 15. Which of the following statement best describes the role of inhibin in regulation of spermatogenesis? The correct option is inhibin is secreted by Sertoli cells and inhibits FSH secretion from the anterior pituitary and serves as a marker of spermatogenetic activity. See, inhibin is a hormone secreted by Sertoli cell, as I said earlier, granulosa and theca cells. And this Sertoli cell, this inhibin which is secreted, as the name suggests, inhibin acts as an inhibitory hormone to FSH hormone. So FSH secretion will be coming down from the anterior pituitary. So this acts as a marker of spermatogenetic activity. So when we come to other options, that is option A, is incorrect because inhibin is secreted by the Sertoli cells. That is not by the Leydig cells. Option C is also incorrect because inhibin is not a hypothalamic hormone. It has no direct role in testosterone production. And option D is also incorrect because inhibin acts as the anterior pituitary to suppress FSH, but not directly to the Leydig cells or GnRH neurons. Question number 16. According to the recommended guidelines for semen donation, which of the following is correct? The recent guidelines of Fertility Act 2021 for semen donation, it has a young male can donate semen for not for more than 25 pregnancies, and his maximum age should be between 21 to 45 years, and he should be screened of all the transmittable sexually transmitted diseases like HIV, HBsAg, syphilis, etc., irrespective of his health status. And this is an important rule formed to prevent the consanguinity. So not more than 25 pregnancies are to be formed from a single donor. With correspondence to this, all other options are wrong. What is the eligibility criteria for a surrogate mother under Surrogacy Regulation 2021? From 2021 onwards, Indian government has formed a strict surrogacy rules in order to exploit the Indian women, the pure especially being which has happened prior that. To prevent that, the Indian government has formulated certain rules in which women who is married or unmarried within the age of 21 to 40 years of age, who should have a baby of one of her own, and should be a relative of the couple who wish to go for surrogacy, and must have surrogate couple should not have any prior children. These are the rules which Indian government has formulated in 2021. So with these answers, correct answer here is must be a close relative married with at least one child between 25 to 30 years and cannot be surrogate more than once. So this is corresponding with answer B. So answer A, C, D are wrong because the 21 to 40 years is wrong, and only unmarried women, no married and or unmarried doesn't matter, must have no previous child. Question number 18. Which enzyme activation plays a pivotal role in initiating the acrosomal reaction during fertilization? Protein kinase A, C, tyrosine kinase phospholipase. The correct answer is B, that is protein kinase C. All other enzymes play an important role in the fertilization, but initiation of the acrosomal reaction has association with protein kinase C. Other enzymes like protein kinase A is involved in signaling process, and tyrosine kinase is also involved in signaling process. Phospholipase C is generating signaling cascade, but not initiation the cascade, the acrosomal reaction. Question number 19. What is the initial event that triggers the Zona block during fertilization? Zona block during fertilization, after this immediate process happens, that will lead to rapid depolarization of the oocyte membrane. This rapid depolarization definitely leads to the prevention of the polyspermy. So initial changes of Zona block occurs through a rapid depolarization of the oocyte membrane, preventing multispermia. When we coming to other option, cortical reaction, this contributes to the permanent block to polyspermy by modifying the Zona pellucida, but not the initial event. Rapid polarization is the correct answer. Release of the enzyme from Zona pellucida, this happens in the later stages, but not the initial event. Fusion of the sperm with oocyte, this happens after the initial event, but not the first event. The formation of pinopores on the endometrial surface is induced by the which hormones? The pinopores are a kind of receptors which develop in endometrium during the luteal phase, which is initiated by the progesterone. So all other hormones are responsible for different phases of endometrial development, but not the pinocyte formation. Which of the following is the correct order of stages during implantation? See, implantation, as I said already, when we open a door, we just go near the door and then hold the lock, open it, and then we invade. The same process. Apposition, and then apposition is coming near to that. Addition is closely attaching, and then invasion. So these three options are corresponding with the option C. Which cytokine is known as upregulator AVB3 integrin expression in the endometrium? This is tumor necrotic interleukin C. So the correct option here is leukemia inhibiting factor. Leukemia inhibiting factor is a cytokine that plays a significant role in promoting endometrial receptivity and upregulating the AVB3 integrin expression. Other options like tumor necrotic factors are involved in inflammatory and immune responses. Interleukin 1 is incorrect because this is involved in various immune responses but not in upregulation of the AVB3. And insulin-like growth factors, they are not involved in AVB3 expressions. Question number 23. Correct sequence of steps in PCR, polymerase chain reaction. This happens in the process of embryo formation, wherein the sequencing and implantation, implication of DNA should happen, in which DNA has to replicate. For this replication, first DNA has to unnature itself, and then process of annealing and amplification. For this, the correct option is denaturing, annealing, and amplification. In denaturing, the double-stranded DNA, which is like this, it separates, and annealing is primary. These two separated strands acts as a template, and the primary bonds complementary to DNA sequence attaches here. That is a process of annealing. And extension and amplification means this acts as one DNA and this acts as another DNA. So these three steps are corresponding with option A. Question number 24. All of the following are true regarding GnRH secretion except GnRH produced originate. Yeah. The correct answer is GnRH is a nonopeptide. GnRH is a hormone. This is an olfactory placode secretory hormone which has got very less half-life, that is only 2 to 4 minutes, and primarily located in arcuate nucleus. All of the following are true regarding except. Yes, this is GnRH is originating from olfactory placode itself. Arcuate nucleus is the key secreting factor. Yes. C is it is an nanopeptide. That is wrong. That is a decapeptide. And half-life is 2 to 4 minutes. That is correct. Question number 25. 29-year-old man presents with infertility workup. Semen analysis shows azoospermia. FSH is elevated. Testosterone is normal. Testicular biopsy reveals Sertoli cells only syndrome. What is the next step? This FSH is elevated and Sertoli cells only syndrome shows. There are some kind of sperms are seen in which those have to be extracted. So that is done with the testicular sperm extraction method. And clomiphene citrate is not true because that is for a explanation like that is for a primary failure. IUI is done wherein sperm concentration or motility disorders are seen. IVF embryo transfer with donor sperm. We should not go with the donor sperm unless there are absolute zero chance from a partner. Thank you.